Building on our previous videos over screws, I wanted to briefly go over some of the common plate types that you will see on rotation. To start, here are the different types of plates you will see. These are fair game when getting pimped, and even if you are never asked about the plate types and function on rotation, it is still a great topic to get familiar with early on to help supplement the learning curve when you ultimately become a resident. The most common plate types include compression, neutralization, bridging, tension band, and buttress plates. Starting off with a compression plate, these are utilized to apply compression, of course, across a fracture. These plates are great for simple fractures as it can compress the two bone fragments together to provide absolute stability. A limited contact dynamic compression plate, as seen here, is an example of a compression plate. Note the dynamic aspect of the plate is due to the oblong holes, giving one the ability to drill the screws away from the fracture in order to compress the fracture. The undercuts on the plate reduce the vascular trauma. Next, we have the neutralization plate. Neutralization plates are typically applied across fractures that have been compressed using lag screws in order to provide stability against torsional forces that the lag screws alone would leave the bone vulnerable to. You can see an example here. Next, we have bridge plating. These are commonly used for comminuted fractures and can be used in polytrauma patients to help provide damage control stabilization. These plates are fixed to the proximal and distal segments and leave the comminuted fracture zone untouched, as to not disrupt the vasculature to optimize healing of the bone. Next is the tension band plate. Tension band plates take advantage of the natural tension your body exerts with movement and converts those tensile forces into compressive forces. These are commonly seen in the fixation of patella fractures, for instance, as you can see here. Lastly, we have the buttress plate. These are best indicated for type B fractures, which, as you will recall from an earlier video, are partial articular fractures. Buttress plates provide support under dynamic compression. You can see here how these plates can be utilized in tibial plateau fractures and as well in acetabular fractures. Okay, that is all for this brief overview on the main 5 types of plates. Hopefully now you will have at least a basic understanding of when you might see each used and will have an easier time recognizing these on rounds with the team.